And back on Talk of the Town as we get a chance now to talk about a pretty interesting topic, and that's allergies, as we bring in Eric from the Medicine Shop Pharmacy over in Monona. And interesting to the point that some of them, sometimes they come and go. I used to have a maple pollen allergy, moved to Texas for a couple of years, came back to Wisconsin, it was gone, my allergy. So it's kind of weird how they can come and go. But in the spring months, it seems like, Eric, a lot of people are affected by allergies. What's causing all the sniffling going on right now?
Most times, especially in seasonal allergy situations, such as in the spring, you get the pollens from the trees that are budding, you get the ragweed, you know, that type of stuff. All those pollens create an allergen that for certain people that have allergies, their body creates an immune response to that allergen being around, and it tries to attack it and get rid of it. And some of the ways it does that is the typical, you know, watery eyes, itchy eyes, the runny nose, the sore throat that kind of can go along with that, and even sometimes headache and things like that. So it's really just your body recognizing something that it thinks shouldn't be around and reacting, and sometimes overreacting to it.
And then it takes care of it in the worst possible way for you while you're at work. You know?
It doesn't make you feel very good, yes, absolutely.
No, not at all. So what options are there to treat those spring allergies?
There's a bunch of different options, and actually over the last couple of years, there's even more over-the-counter options than there ever used to be. You have your regular antihistamine tablets. Those would be things like Allegra, Claritin, or Zyrtec. Those are kind of the three common ones. There's also older ones such as Benadryl. But now there's even nasal sprays, and there's eye drops that are all available over the counter. In fact, there's not many that are prescription only anymore. Most of those have moved over the counter.
Yeah, and they used to be prescription. I know at first I tried Claritin. That didn't work for me. Zyrtec, tried that. Boom, worked like a charm. So how do we know which one's going to be the best for us?
You know, there's certain populations that should, avoid certain medications. But there's a lot of people that, such as yourself, sometimes it's just trial and error, if you don't have that kind of caution to do. So the special populations that, I would probably steer in a certain direction. Some older folks probably shouldn't take anything that could possibly make them drowsy. That could lead to the risk of falls. Some other people that have high blood pressure probably shouldn't take anything with a decongestant in it, even though that you might have some of that congestion around for the allergies. And the reason for that, it can raise your blood pressure. So there's special populations that you should steer to, people towards certain ones over others. But for you, like you said, sometimes it's just unfortunately trial and error, see which one works for you, and that's a very common thing that happens.
Absolutely. Now, with all of these options that are out there, and the nasal sprays, and the eye drops, and the pills, are they all created equal?
Well, some have different, like I said, side effect profiles. Some have a little bit more of a tendency to cause some drowsiness in people. So again, if you're taking medications that can cause that, if you're elderly, I'll steer you in a different direction. But overall, their effectiveness for most people, unfortunately, like you said, you have some people that will respond fantastically to Claritin and not be able to take the Zyrtec because of the drowsiness or things like that. So are they created equal? Yeah, they kind of are, but still you can have individual patient differences that this one works better for me. For another patient, it might be the exact opposite.
Now, if I come into your pharmacy, are you guys well versed in that? Because it seems like otherwise there's a lot of reading of a lot of small letters to get through. So.
Absolutely. At the Medicine Shop, we are so happy to come out from behind the counter and educate patients. I always tell people that's what we went to school for. I didn't go to school to slap a label on a bottle and say, do you have any questions? I really went to school to learn about medications, to properly educate my patients on what they should take and help improve their healthcare quality of life. So we'd be more than happy to, you stop in to come out and spend some time with you with those products.
Now, what about some other options? I mean, some people just don't want to take another pill or put more medicine. Are there non-pharmaceutical options that are available?
There are. The biggest one that comes to mind is called a neti pot. And I don't know if the viewers know what that is, but basically it's a saline solution that you can pour through your sinus cavities. You pour it in one nostril and it flushes everything out. It's not the most pleasant thing in the world, but the nice thing is, like I said, it has absolutely no pharmaceutical ingredients. You're basically just flushing that out, and in turn, you're flushing not only the phlegm and that kind of stuff out, for lack of a better term, but you're also flushing out those allergens, so you can kind of wipe those from the system.
Not a lot of people having neti pot dates, right?
I think that's safe to say. Yes.
Something you do on your own. So,
exactly.
Eric, thanks for joining us. Yeah,
Thank you.
very good information. So check it out at the Medicine Shop Pharmacy in Monona. We'll be back with more Talk of the Town right here on CW57.